Hi, my name is Michelle Fenwick. I'm here in the East Las Vegas Built from Scratch lab bringing this YouTube clip to you. I'm a registered nurse, a hospice nurse, and a Toro student in the RN to BSN program. And I'm here today to talk about the ePatient, who the ePatient is, how it interacts with IT, what's the safety concerns, what's the pros and cons, and finally, the ethics as a nurse that we need to be concerned with. I hope you enjoy.
What is the e-patient? An e-patient is a person that tries to participate fully in his or her medical care by gaining information, seeking advice, and finding support about their condition via sources such as the internet. Now, a broader definition of an e-patient can also include individuals that do so on behalf of a friendly or family member, such as parents of a minor child or a guardian of someone with Alzheimer's. Regardless, the E in ePatient may stand for one of the various characteristics describing such individual with respect to their health and making healthcare decisions. They are enabled. They have or be given the means, ability, and power to participate in their own health. E-equipped, whether it be with the internet or other means. E-electronic, as in they may use the internet. E-empowered, thanks to the information they find. Engaged in their own medical care because they find it so important to be engaged. And finally, the most important, equal. In other words, they see themselves as an equal partner with their doctor or healthcare provider when it comes to participating in their medical care and making the best decision for them or the person in which they're acting upon. Nurses deal with private information all day, every day, from nurse's station, doctor's office, to exam rooms, patient bedsides, operating rooms, and finally giving care in patients' homes. Many nurses, due to their focus on patient health and the constant contact with this patient health, can become desensitized to the importance of HIPAA compliance and protecting the digital and physical paper trail. But the facts remain. All patient information is confidential and federally protected. The Health Insurance Portability and Accountability Act, and specifically the privacy and security rules, outline how individuals, including nurses at covered entities, should collect, use, and handle protected health information. The security rules require appropriate administrative, physical, and technical safeguards to ensure confidentiality, integrity, and security of electronic protected information. Simple ways nurses can help improve the security and privacy of patient information no matter what they're doing in the facility. Be aware of your situation awareness. This could include speaking quietly while discussing patient information with colleagues or patient family in a public place. For example, don't discuss patient information in the hallway. Go into the patient's room or a quiet, protected area. If you're giving care in the home, do not discuss sensitive information where a family member that the patient does not want to overhear can participate. Second, document handling. Despite the huge increase in the electronic healthcare records, healthcare facilities still heavily rely on paper files. Physically safeguards should not be overlooked when working with HIPAA compliance, meaning don't leave lab values out on the medication cart, or if you work out in the field, leave sensitive information in your car in which someone can easily view through the car window. Third, access to electronic systems. HIPAA states that the healthcare provider must implement physical measures, policies, and procedures to protect a covered entity's electronic information system and related buildings and equipment from natural and electrical hazards and unauthorized intrusion. Simply put, make it difficult to hack and have the building equipped for natural disasters. Finally, number 4, and the most important, a team effort. There is no doubt that nurses play a critical role in protecting patients and their personal healthcare information, but the effort is not solely on the caregivers. All healthcare staff need to commit to the following security and privacy policies in place to help create the first line of defense in protecting confidentiality patient information. ePatient provides safety in healthcare by preventing medication errors. In the EMAR system, medications are automatically checked for medication interactions and having adverse reactions and check against patients' allergies. The ePatient also is a more informed and engaging participant in their care since the internet can provide answers to questions prior to the appointment with the doctor. Finally, the ePatient improves quality by interacting with the healthcare professional using technology. This is pertinent in the rural areas where telemedicine steps in, allowing patients to get the care that they need from healthcare providers over 1,000 miles away. In the past, the model was doctor knew best and the patient followed the rules. This is now migrated to the patient-centered care model. The patient is the center of care, but also, and more importantly, the patient is a full member and the partner of the healthcare team. Patients are the expert in their own medical history and what works for their body, and they deserve the right to exercise patient-driven controls. Patients know what works best for them given their personal circumstances, their preferences, and their bodies. Quality in healthcare means engaging in involving the patient so the patient takes ownership in not only their preventive care, but the treatment of acute care as well. Computer literacy patients are seeking to take more control of their health by using the internet to seek out information related to illness and treatment. The information provided on the web can help patients better understand and manage their illness and be more capable to doing informed choices. E-patients can be active in their care. This allows them to be safety buffers in their care. However, this does not absolve the responsibility of the healthcare provider. A note about using social media sites as an e-patient. Read the conditions of use and privacy statements. Read the About section to determine who controls your medical data. This gets more important as large entities such as Google purchase healthcare tracking sites such as Fitbit. Ask questions if you're unsure. Treat people with kindness and respect. If you're feeling a strong emotion, compose your comments and let them sit for a while before posting. Once you post, the internet never forgets. Then finally, carefully evaluate the information posted by others. Read the entire article. Just because something's posted on the internet doesn't mean that it's been peer reviewed or it'll work best for you. It's always best to follow up with your provider. There are pros and cons to anything, and this includes being an e-patient. The pros of being an e-patient is accurate and up-to-date information. You don't have to worry about sloppy handwriting, obscuring lab results, or medication orders. There's quick access to medical records, ease of sharing electronic health information, improved patient and provider communication, and finally, promotes patients taking an active role in their own plan of care. The downside, of course, is healthcare records theft, weak cybersecurity, and finally, the nurse. Nurses must be vigilant to ensure that they do not accidentally expose patient information and violate HIPAA.
I hope you enjoyed the short introduction on what the ePatient is, and I hope you're able to implement it in your practices. If you wish to find any more information, please look below in the description. Thanks.